ವಿತೇಶ್ ಅಂತ CKD ಪೇಷಂಟ್ 1 ಇಯರಿಂದ ಡಯಾಲಿಸಿಸ್ ಆಗ್ತಿದೆ. 2 ಇಯರ್ ಗೊತ್ತಾಗಿ ಸ್ಟಾರ್ಟಾಗಿ ಅಂದರೆ ಪ್ರಾಬ್ಲಮ್ ಸ್ಟಾರ್ಟಾಗಿ 2 ಇಯರ್ಸ್ ಆಗಿದೆ. 1 ಇಯರಿಂದ ಡಯಾಲಿಸಿಸ್ ಸ್ಟಾರ್ಟ್ ಆಗಿ. ಆ್ಯಕ್ಚುಲಿ ಉಡುಪಿ, ನಮ್ಮ ಪ್ರಾಪರ್ ಉಡುಪಿ. ಇವರು ನಮ್ಮ ಚಿಕ್ಕಮ್ಮ ಅಂತ, ಆಶಾ ಅಂತ. ಇವರು ನಮ್ಮ ಅಮ್ಮ ಯಶೋಧ. ಸೊ ಬಿಫೋರ್ ನಾವು ಉಡುಪಿಯಲ್ಲಿ ಟ್ರೀಟ್ ಮಾಡ್ತಿದ್ದದ್ದು. ಸೊ ಅಲ್ಲಿ ಆಗೋದೇ ಇಲ್ಲ ಅಂತ ಹೇಳಿದರು. ಓಕೆ, ಟ್ರಾನ್ಸ್ಪ್ಲ್ಯಾಂಟು ಈ ಥರ ಎಲ್ಲ ಟ್ರೀಟ್ಮೆಂಟು ಆಗೋದಿಲ್ಲ ಅಂತ ಹೇಳಿದರು. ಸೊ ಆ್ಯಂಟಿಬಾಡೀಸ್ ಜಾಸ್ತಿ ಇದ್ದದ್ರಿಂದ ಪಕ್ಕ HR ಆಗಿದ್ದರು ಉಷಾ ಅಂತ. ಸೊ ಅವ್ರು ರೆಫರ್ ಮಾಡಿದ್ದು ಆ್ಯಕ್ಚುಲಿ ಡಾಕ್ಟರ್ ಹರ್ಷ ಸರನ್ನು SPARSH ಹಾಸ್ಪಿಟಲಿಂದ. ಸೊ SPARSH ಹಾಸ್ಪಿಟಲಿಗೆ ಬಂದ ನಂತರ ನಾವು ಹರ್ಷ ಸರ್ ಆ್ಯಂಡ್ ಸುನೀಲ್ ಸರನ್ನು ಮೀಟ್ ಆಗಿದ್ದೀವಿ. ಸೊ ಅವರು ನಮಗೆ ಅಂದರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ ಆ್ಯಕ್ಚುಲಿ.
I'm Dr. Sunil, consultant nephrologist and transplant physician at SPARSH Hospital, R Nagar, Bangalore. Once we started evaluating the patient for transplant, we initially called mother as a donor for transplant. During the process of evaluation, we came to know like she had hyperthyroidism and also had a pacemaker in situ. Then she was found to be unfit to be a donor since there were no other family members which were willing to donate. Then ultimately, when we discussed with the other family members, aunt came forward to
myself, Dr. Harsha Kumar H N, at present working as senior consultant nephrologist at SPARSH Hospital, Bangalore. So when the aunt came forward to donate, we evaluated her, and to our luck, she was a haplo match with the recipient, that is Vithesh. But when we did a basic workup, immunological workup in the form of cross match, we found that patient had a high class 1 antibodies. So we went ahead and did a single antigen bead. So we found 2 antibodies against class 1 and single antigen against class 2, which was considered to be highly immunological risk of rejection and everything. So we counseled the donor and the recipient, but donor and recipients wanted to go ahead and take that chance. So we planned accordingly.
ನಮ್ಮ ಚಿಕ್ಕಮ್ಮ ಅಂದರೆ ನಮ್ಮ ತಾಯಿಗೆ ಆ್ಯಕ್ಚುಲಿ ಅವರು ಕೊಡುವವರಿದ್ದರು. ಅವರಿಗೆ ಕ್ರಿಯೇಟಿನ್ ಜಾಸ್ತಿ ಆಗ್ತದೆ ಅಂತ ಹೇಳಿ ಬೇಡ ಅಂತ ಹೇಳಿದರು. ನಮ್ಮ ಚಿಕ್ಕಮ್ಮ ಮುಂದೆ ಬಂದು ನಮಗೆ ಮರುಜನ್ಮ ಕೊಟ್ರಲ್ಲ. ಸೊ ಅದೇ ರೀತಿ ಯಾರಿಗೆ ಯಾವ್ದು ಮ್ಯಾಚ್ ಆಗಿ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಅಥವಾ ಯಾವ ರಿಲೇಷನಲ್ಲಿ ಅಥವಾ ಮ್ಯಾಚ್ ಆಗಿರುವಂಥದ್ದು ಈಸಿಯಾಗಿ ಕೊಡ್ಬೋದು. ಹಾಗೂ ಅವರಿಗೆ ಜೀವದಾನ ಮಾಡಿದರೆ ನಮ್ಮ ಚಿಕ್ಕಮ್ಮನ ಥರ ನನಗೆ ಹೇಗೆ ಮರುಜನ್ಮ ಕೊಟ್ಟಿದ್ರೋ ಆ ರೀತಿ ಎಲ್ಲ ಡಯಾಲಿಸಿಸ್ ಪೇಷಂಟ್ಗಳಿಗೂ ಅವರು ಕೊಡ್ಬೋದು, ಜೀವನ ಕೊಡ್ಬೋದು. ಸೊ ಧೈರ್ಯವಾಗಿ ಮುಂದೆ ಆರಾಮ್ಸೆ ಆಗಿ ಬರ್ಬೋದು ನೀವು.
Since it was a high-risk transplant, we advised them for a desensitization therapy. As a part of desensitization therapy, patient received 2 doses of rituximab prior to the transplant, and prior to the transplant 3 months before, patient received triple layered immunosuppression. So after receiving the immunosuppression, patient also received 1 session of plasmapheresis before the transplant. So after the plasmapheresis and 2 doses of rituximab, we repeated the single antigen bead assay. So during which the levels which were as high as 11,000 was found to be less than 1,000 at the time of transplant, and subsequently we advised the patient to go ahead with the transplant.
So on the day of the transplant, we gave a good dose of induction agent of 150 mg and followed a normal triple immunosuppression. Immediately post-transplant, there was a very good diuresis and kidney function started improving. Within post-op day 2, the creatinine came down to 0.7, and we monitored him for till day 7, and we discharged him in a very healthy status with a creatinine of 0.7, and transplant went well.
This is one of the rare instances where a high-risk transplant has been performed at our hospital. Though this patient had both class 1 and class 2 antibody, we were successfully able to do a transplant, and post-operatively patient had a good graft function. So this also proves like with the modern immunosuppression and modern treatment, we are able to successfully conduct a transplant in this patient. But one important thing is this patient requires continuous follow-up and regular monitoring of the antibody levels at least for a year post-transplant. So that this patient, we have advised him to undergo regular monitoring with our hospital, and patient was suggested to undergo the regular follow-up regularly.
ಅದಕ್ಕಾಗಿ ನನ್ನ ತಂಗಿನೇ ನಾನೇ ಕೊಡ್ತೀನಿ, ನೀನು ಕೊಡೋದು ಬೇಡ ಅಂತ ಒಂದು ಧೈರ್ಯ ತುಂಬಿ ಅವಳು ಒಂದು ಕಿಡ್ನಿ ಒಂದು ಅವಳದ್ದು ಒಂದು ಅಂಗ ಒಂದು ಕೊಟ್ಟು ನನ್ನ ಮಗನ ಜೀವ ಒಂದು ಉಳಿಸಿದ್ಲು. ಈ ಸ್ಪರ್ಶ ಸ್ಪರ್ಶ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳಲಿಕ್ಕೆ ಬಯಸ್ತೀನಿ. ಇಷ್ಟೇ ನಾನು ಒಂದು 2 ಮಾತು.
So this kind of surgery or this kind of iris transplant can be conducted with modern immunosuppression in our hospital without much complications. So this also gives us evidence like though patients are sensitized, though the patients have a cross-reactive antibodies, we'll be successfully able to eliminate these antibodies and conduct a transplant.